She got
Lay down.
volunteered.
Okay.
Do you want me to smile?
Missy and I are here to talk about using the transfer board or the slide board, whatever you want to call it. We are going to show you two different techniques, and we'll talk about kind of why you would choose one over the other and when.
Okay.
So, most of the time with these transfer boards, all we're doing is bridging the gap between the surfaces, and then you're sliding the patient across. And for the most part, that technique works best because it's the least amount of friction for you from a safe patient handling perspective. You sliding the patient across, it reduces the friction, and so it's the better technique between the two for moving patients from surface to surface, because it's taking less effort for you.
Right.
So what we're gonna do is, okay, you're locked in here, and these are about, you want them about the same level or slightly below.
Okay. So
And
the
then
first technique that you're gonna show us.
We're gonna do the pull across.
Okay.
And second technique, we're gonna move the board.
Okay. And so both of these techniques
Are valid.
are valid.
Yes.
And
And
it's-
so the way you would choose, so here's how I would describe it is, if you're doing something that you have help, like let's say there's a couple of you.
Okay.
The best way to do it, and your patient can tolerate rolling from side to side, the best thing to do would be to use the pull across method because it's better on your back and your body mechanics, and a little bit more comfortable for the patient because they're not resting on the board.
Okay.
The boards are radiolucent though, so let's say you're working alone or your patient's not tolerating getting moved from side to side, then you can leave them on the board as long as you're not doing a long procedure. So if you're doing something that's gonna take 20, 30 minutes,
Right.
take them off the board.
Okay.
But otherwise, it's fine to leave them on it for a CT scan
For
or
CT
an
scan,
X-ray.
it's
Yeah,
okay.
and this,
Okay.
this was the longest scan that you just saw, the longest scan we have.
And it was like 10 minutes.
And it was a total of 10 minutes
Yeah.
because with that 8-minute delay plus the 2-minute scan time for
Yeah.
the without and then the with.
And that's totally fine.
Yeah.
It's when you're doing like an MRI that we don't really want you
Oh,
to
yeah, I
leave the
don't,
boards
I don't
under
think we don't
patient.
ever leave the boards under a patient
Yeah.
for an
So
MRI.
we'll
It's-
do-
it's
So
just-
do you, once the patient goes through and has their test, and then you bring them back to the cart, do you take them back to their room?
The ER room.
The ER
Yeah,
room?
but they're
yes.
not on the board.
And you've got the board out?
The board, they're already
Okay.
off the board back
Okay.
on this cart.
Okay, gotcha.
Yeah, we don't leave the board under them. I admit I
Yeah.
made one mistake one time and somehow it was still under them. I was by myself.
Yeah,
And I
that is a-
felt bad, but it wasn't under there for more than 15 minutes if
Yeah.
that.
And the thing
And-
is, that's a skin issue, so the
Right.
reason why we're not leaving A, comfort,
Right.
obviously, but B, skin breakdown. We
Right.
don't want their skin to break
And
down
we just
on the
don't.
hard
I mean,
surface.
I think we all know that you just don't leave a board
Yes.
under them.
Right.
So that was
Right.
not intentionally
No.
done. And I know that we can't leave this under them.
Yes.
Have you guys felt like the bigger difference too of how it feels when you slide somebody versus when you pull somebody? Have you
That's
guys
what we
compared?
want you to get a feel for.
Because
Okay,
we
right.
actually practice that
Yeah.
way.
Well, we've done it both ways. It just
And
depends
it's-
on
No,
patient
as
condition.
the patient.
Well, both
Yeah,
ways,
right.
but it really,
Yeah.
what seemed for us that it was a smoother when it was a slide over, but Jackie and I were at different ends because I was the person that was like, no, they stay on it. She was the person that said, no, they slide over. And then
Okay.
as we researched, we found, both ways are valid.
Yeah.
Oh, wow, okay.
So,
Yeah, they are.
And you're taught, so in nursing, you're taught to slide them over because what you're doing in nursing is you're sliding them from one bed to another bed. You're never gonna leave a
Leave
board
them
under
on
a
it.
patient.
Yeah,
there's no
need
And
to.
Right,
because
yeah.
you're hauling so many people around, from a safe patient handling perspective, pulling that patient across and having someone help push, that is a better technique. So you're sliding them
still
across. It's easier to take the board out because it's only halfway under your patient.
Okay.
So, but if you're looking at it from a radiology perspective, and a
Right.
lot of times you don't have a lot of hands to help you, when you're just sliding them over and sliding them back in a short period of time, it does make sense to leave them under. So there's different techniques for both ways. So that's what we
Okay.
kind of want to show you, how both work and why you would use it
Okay.
when.
Okay.
So,
and just
Yeah.
to say the few things about the body mechanics
Oh,
too,
yeah.
the housekeeping kind of things,
Okay.
just to help prevent injuries too. Technique is really important as far as like you guys already did raise. Remember that you're raising to the height of the shortest person, hip height of the shortest person. So don't have it too high for that
Okay.
short person so that they are able to help. And your positioning with your feet should be feet apart and feet this way, so you can use the lunge more than your bent over the bed.
Right.
Jackie's
You don't want to do this, you don't want to do that.
Yeah. Okay.
And
to
are we
prevent
supposed
injury.
to do the hands this way?
Under instead of over. I like.
I always.
Well,
I
after watching all those videos, I was like, oh, I can do that.
You have more
feel like it's
strength
divided.
this way than you do
Okay.
this
You
way.
always have more
But-
strength pushing than pulling.
Yeah. Okay.
And yes, that for your back, always, you know, more
Okay.
wherever you can pull something versus push, you know, is important too.
Can I help you?
Said, let's go ahead. So we'll demonstrate, and then we'll guys have you do it.
Okay.
So we're just gonna get in here, and then how do I load this? Like this? Yes. Okay. Now
We're
here we
gonna
go.
pull over first, right? Sorry.
Yep. So you want to make sure your patient is safe, obviously. So don't leave her sitting here while you go wander off, and she'll go rolling right off.
Does this go higher for you guys or
Yeah,
no?
it does. Yeah.
But
I mean,
and
we-
that goes higher too, right?
Yeah.
So
Do you want it more turned?
I would say, yeah.
Yeah,
For,
I tend to feel the same way.
Yeah,
We
just to
just
prevent
kinda stopped
injuries.
it,
Yeah.
yeah.
Yeah. So that's probably good here because this one lets me a little bit lower.
Yeah, we're both kind of short, so
Yeah.
right around hip height.
Yeah. And
Now, if your patient can, you can have them help, but go ahead and cross your arms for me. And then if you put this leg over the other leg and we'll turn. So I'm doing this alone. Ideally, you want another person. So we're gonna go ahead and roll. She's very compliant. And you want it about halfway under your patient.
Okay.
And then
You
roll
are
back.
compliant.
And then
She's a
I
sassy
just
one.
want to make sure her head and her feet don't get scraped across the board when we go across. So I have Missy here to help me, and we're going to count on the count. Now these stretchy sheets are not ideal. If you can get a draw sheet under them, that's always better.
Right.
But we
Get
got it.
them
We want
slapped
this to be like real life. So
Yeah,
we're
all
gonna use
the ER
stretchy
stuff
sheet.
comes on these sheets. All the ER patient stuff, not stuff, but
All
patients.
right. So then on 3, we're going to slide her across. So 1, 2, 3.
the board came
And the board came with her. So, in this case, normally, if we transferred her from one bed to another, she would have slid all the way across the board, and we just take the board out. So we'll go ahead and take the board out.
So
Which way we going?
we're gonna have to roll that way. Okay.
Can't roll.
I'm just gonna shimmy.
We're helping you anyway, because you're an invalid.
I can't get my butt out of the crack out here. It's falling in.
All right, so how did the board feel under you?
You were just really, really fast, which was scary. We don't go that fast.
We don't
but
go that
okay. I was
Okay,
like,
do you guys
whoa.
pause halfway, like do you go 1 and then 2?
Well,
or
usually
do you
we'll
just-
have one person hold onto the board and push, so we've got one hand on the board holding it, so it'll stay
Yeah.
here.
Yeah.
Okay.
And then
And
pushing
they push.
while
Yeah,
someone else.
usually there
If-
they push, this person pulls.
If there's
this
more than one, but there's
Usually we
not
want
always.
3 people to
Yeah.
do this
That's-
technique.
Yeah, that's not real.
Right.
Yeah, that's what we
So,
found. Yeah.
Yeah.
Okay, so
And we let, I personally put a slider sheet under.
it's best to have a slide
Which-
technique. So we're gonna roll you toward Missy, and then we're gonna get the board under you. So same thing. You only need to put the board.
It's hard to get into this crack. 'Cause it just dips.
Crack kills, man. So like you were saying, if we're sliding this patient onto this surface,
hair is
which
gonna
is
be a hot
kind of
mess after we're
sticky,
done.
you would want
Right.
another sheet to help glide it across. But let's just pretend we don't have that. So go ahead and roll back. Now, what's different about this technique is we're gonna keep the board under her. So we're working with limited staff, and we're moving her from one spot to another really quickly, or she fractured her hip and it hurts to roll. So we're just going to slide her onto the board, and then we're gonna slide the board across. So,
Are we pushing towards you?
yep, on 3. 1, 2, 3 onto the board. Yep. And then we're just gonna take the board across. 1, 2, 3. Yep. Now, she can get her imaging and whatever she needs. She's on this board. We don't, then when we're done, all we have to do is slide the board back
Right,
across.
And just for clarification, it's cool, it's okay to keep her on the board during the diagnostic
Yes,
test.
this
Yeah.
board is
Because
radiolucent, and, but again, short periods of time.
Of course.
Yeah.
So,
Of course.
And there's even, when Jackie and I were researching too, several of the, or at least one of the boards that we had at the hospital, it actually shows the person staying on the board the entire time.
Yes.
too.
Oh,
Okay.
So there's,
Yeah.
like
So
I
there
said, 2
is,
different
okay.
techniques.
Yeah,
So, but
it's
for
valid.
most
Okay.
things that we're doing, there's less friction involved if we slide her across the board. There's more friction involved if we're pulling the board. It just takes a little bit more effort from a safe patient handling perspective.
And
So if
protecting
you
your
can,
back.
slide them across,
Well,
but
we can
otherwise,
slide them
this is
across. It's really easy to slide them across, like
when you have another
on
sheet.
this.
Yeah, yeah.
And then honestly, I get putting the board in the center and sliding them across, but then we want to put the board back under them so we can move them on our table.
Correct.
And that's when some of the staff, that's when we don't
Yeah.
we don't agree.
So
because-
it's perfectly fine, slide your patient onto the board and slide your board across.
Okay.
Leave it under for 5 to 10 minutes.
Okay.
For that duration is fine, and then that way you're ready to slide them back without any issue.
So now how do you get, if she's on my ER cart, how do you get that board off now?
So to get her, if she's just on this ER cart, to get
And
the
now-
board out, so I can see what you're saying is that it's narrow.
She's
and
gonna stay on
here.
this.
So let's
Yeah, so
move the
let's-
cart.
let's move
Don't
it.
do this with a real patient.
Oh, see, I always would do this.
Move her out. Yep.
That way when she rolls up, I
And then
have
you
her
gotta
raise
put
her
it
up
So do
there.
you want a slider,
Reach
a
over
sheet
and
under
hold
her?
onto this bar here, ma'am.
Yeah,
We're gonna slide this out from under you.
And you might have to do it in
and
increments.
you're not
like a little
gonna
bit,
fall. Don't worry, you won't fall.
And then tip.
There, now you can roll back. How was that?
That was. And she's staying in the center.
Yeah, you just have to make sure your rail is up so she doesn't be.
Before I would have done
Anytime
that
you're turning, the
though,
rail needs to be up.
I would have used this to scoop her up before I would have even pulled it
That's-
out
yeah,
too.
that would have been
So make sure
smart.
she's positioned
Boost her.
and then take it out. Yeah, so then you don't have to do the boost after, because this is an excellent, like you guys use it.
It's a great
to
boost.
boost.
Yeah,
Yes.
especially in
Have to
X-ray,
adjust,
because I have to move the patient around.